Hello, my name is Professor Sylvester Henderson. I am the CEO of Professor for Life Incorporated. On Professor for Life Incorporated, I interview primarily academics and great professionals. And today I am so honored to be able to interview Dr. Brian C. Richardson, who is a neurologist for Alta Bates Summit Medical Center in Berkeley, California. Welcome, Dr. Richardson.
Thank you very much. Glad to be here.
Dr. Richardson, could you introduce yourself to our digital media world and tell us where you grew up, share your academic journey, where did you attend college, and if you would tell our audience about your degree attainments?
Okay. I grew up in the Bay Area. I was born in Oakland at Highland Hospital, and I grew up in Berkeley and Richmond.
Oh, wow.
And went to public schools in Richmond and Berkeley throughout my youth. And when I was in middle school, I was put into a small private school in Oakland. My mother put me into a school called Golden Gate Academy because I wasn't really focused when I was at Portola Junior High School in El Cerrito. And I'd have to say that was a life-changing experience for me. When I got there, I was impressed with the students. The classes were very small. I was in the 7th grade, and I think there were maybe 30, 35 other students. And these people were studying. These were some studying fools. They were very serious about their academics. And to date, I have to be honest and say, I wasn't into school. I hadn't been into education in school very much since I was in the first or second grade, to be honest. I studied. I was a very good student early on, but then there was a lot of things going on in my life, a lot of drama in my life, and I sort of started gravitating more towards sports and such. And so when I got into this school, I really started studying a little bit, not very much at first. But there was one thing I have to say that was really instrumental early on in pointing me in the direction of where I am now. There was one particular day when I was sent to the principal's office because I was talking too much in class, as was my practice at the time. And after the principal finished hitting me with his little stick that he disciplined the students with, he sat me down and said, "Hey, what do you want to do in your life?" And I said, "I think I want to be a doctor." And he said, "This is what I want you to do. I want you to go to a school called Loma University, and I want you to have a double major in nursing and physical education. That way, if you can't make it as a nurse, you can be a high school PE teacher."
Wow.
So that's what my principal told me. And I was sort of shocked, and I didn't really say much because, as I just illustrated, he was into hitting people. But I was offended that this gentleman told me to be a nurse when I told him I wanted to be a doctor. And nothing's wrong with nurses. I have great respect for them. There's some very intelligent, accomplished people who are nurses, but I found this to be offensive. And it took me back a couple of years to my experiences with the Black Panther Party. I was a child, and for probably 3 or 4 years, the only way I would have breakfast, the Black Panther Party would come and pick me and my sisters up and take me to the Black Panther Party headquarters and give us breakfast and then drive us to school. And when we'd be at this location, they'd be talking to us, while we'd be eating, and they'd be like, "Hey, I remember one time they were telling me, hey, in your life, the white man may say to you, hey, you're no good, or you can't do something, but don't listen to him. You got to have your vision straight and believe in yourself." And I was like, I wasn't paying attention. I was like, "Okay, can you pass me the syrup?" I wasn't really keyed in on this. But when this principal said this to me, it was like, aha, that's what he was talking about. And it really made me see that it gave me the impression that society was not necessarily trying to give me confidence in myself or show me a path that I could go to easily, other than perhaps being an athlete. And I decided then I was going to start studying. And to date, I'd probably gotten mostly C's, an occasional B, but The next year, when I got to high school, I started studying like it was a sport, and like all my best friends were studying, and I studied probably from the time I got home until midnight, 1 o'clock, 2 a.m., whatever it took to learn the material. And so when I finished school, I did well. I think I was number 3 in my class, and went to college. I went to the same college that principal told me to go to. I went to Loma University, but I was pre-med. And when I got there, I was very serious, and I knew what I wanted to do. I didn't know with certainty that I could do it, at least not early on, but I knew what I was going to try to do. And I was pre-med and a biology major, and I studied hard, and I knew how to study because of my high school experiences. That wasn't a transition for me once I got to college. I was already studying hard and knew how to really focus and learn material. And so I did well in college, and I went to Loma University School of Medicine. I applied to a number of schools, got into Howard University, I got into University of California, San Diego, and UC Irvine, and I decided to stick with my dream and go to Loma Linda University. And I finished Loma Linda and began my neurology training soon thereafter.
Wow. What an inspiring story of a young African-American male who started from a point of inquiry and then decided at some point, look, a focus, and became very focused. That is a trait that many young men need today. Dr. Richardson, what inspired you to pursue neurology, and how has that motivation evolved over the years?
Yeah, I think one of the things that initially attracted me to it was in my studies in high school, I really liked studying about nerves and the brain. And it also struck a chord with me because my grandfather had a stroke. And so I had some early exposure from the time I was just beginning high school to individuals who'd had brain disorders. And so I went into college thinking, okay, I'm going to become a doctor and I'm going to become a neurosurgeon. And while I was in high school, I was able to do some research in the summers with some neurologists and neurosurgeons. And I realized I really enjoyed learning about the mysteries of the brain. And at the time, many of the biggest diseases that struck the brain and spinal cord had no treatments whatsoever, no treatments of substance. And so I thought that this was a field that was really ripe for discovery in the future. And so I went to medical school, and I initially knew for certain that I was going to be a neurosurgeon. I did my rotations in neurosurgery. I really liked it. But I had a feeling that I needed to investigate it further. So I did another rotation in neurosurgery, 2 of them. And the staff there, they liked me and they encouraged me to apply to their neurosurgery residency. But then when I really reflected, I realized that the things I liked the least about neurosurgery was the surgery. Interestingly, I liked every other surgical discipline, vascular surgery, orthopedics, general surgery. But neurosurgery I found to be tedious, and frankly, I didn't like standing up looking in a hole about this big for 8 hours, working with little tiny instruments under a microscope. Orthopedics, you're moving things, you're moving your hands. General surgery, you're doing bigger movements, you get to move around. Neurosurgery, looking in that hole all day and doing these little manipulations, it was something that I didn't want to do the rest of my life. And I realized I liked the diagnosis part. I liked the idea of non-surgical medical management rather than neurosurgery. And so I decided to go into neurology. And it's a decision I've been very happy I've been able to do.
Wow. Your reputation is one that is wonderful. Dr. Richardson, being a neurologist is described as one of the most demanding medical professions in your professional field. How have you been able to balance precision, pressure, and really patient care?
That's a good question. One has to be careful in a way, because medicine is kind of like a jealous lover. She will take all of your time and consume you if you let her.
Okay.
By that, I mean, if you don't carve out time for your family, if you don't carve out time for yourself, for your interests, for your humanity, medicine can easily take up everything, all your focus and all your time. And before you know it, you're just lost in this field, and you've lost why you went into it. You've lost your perspective in life. You may have lost your whole family. So I tried to maintain my private interests in my hobbies, my private things I like to do. I try to always keep focused on the things that put me in medicine in the first place, and that is helping people and using my skills, my abilities, my talents to help solve the problems and the questions that are in front of me with these people with their neurological diseases. Because often with neurological diseases, the diagnosis isn't right in front of you. The treatment path isn't right in front of you. You have to interview. You have to be like an investigator, make the diagnosis, and then establish treatment plans. So I found that if I can keep my focus on what originally took me into this field, I can keep my perspective and not just be consumed by the field itself.
You sound like what you're also saying is that you keep a healthy balance of, this is when I work, this is what I do, this is what I enjoy, but now it's time for me to stop for my family and my time, and so that I could rejuvenate myself and what have you.
I try to do that. It's an ongoing struggle, but that's a fight I fight every day, and I usually win.
Well, you have a beautiful family, so I'm sure you've done pretty well at it.
Thank you. Thank you.
Can you share a case or moment in your career that profoundly shaped your perspective on medicine or life in general? Because I know as a neurologist you deal, for instance, I have someone who was a drummer that I'm very close to that was just recently diagnosed with multiple sclerosis. And that I didn't know too much about MS until I realized that it's really a disorder in the brain that sort of affects the usage of the muscles. And it's been very disheartening to see this individual as he has struggled, and he was one of the greatest drummers in the Bay Area. And so I'm wondering, just having those sort of issues that you have to diagnose and offer strategies for improvement or sustaining, how has that shaped your perspective on medicine and life in general?
Okay, so looking back, when I was a resident, I had an experience which probably shaped me and showed me a way that I could make a difference. And I was in training, and there was a patient, I was a resident, and there was a patient who was an elderly woman who had a brain tumor, and she had decided that she didn't want any treatment. She wasn't going to have radiation. She wasn't going to have surgery. Her family was trying to talk her into it. The other doctors were trying to talk her into it. And I had occasion to sit down with her. And I sat next to her, and I was able to make a connection. Even though we were from different backgrounds, different ethnicities, different ages. This was like an 80-year-old woman. I was able to connect with her, understand her perspective, and dialogue with her. And I spent a lot of time with her, and probably about an hour later, lo and behold, she says, thank you for talking with me. After speaking with you, I think I'm going to go ahead and have treatment. And she changed her mind. And it showed me that this is something that I wanted to do moving forward, and this is something I could do. Engage patients, connect with them, read them, see what they were understanding, what they were feeling, empathize with them, and then, if possible, motivate them positively towards treatment options and their futures.
Wow. That is a wonderful story. That effective communication and emotional connection. That's great. With rapid advancements in medical technology such as robotics and AI, how have these tools changed the way neurologists work?
Well, one thing that's obvious to me is that there is so much information out there now that it gives us a lot of tools to make diagnoses. Now, there aren't AI apps that I'm aware of that neurologists are using to make diagnoses, but often we can take disparate bits of information. And in the past, we'd have to just use our brains and our past experience to put those disparate bits of information, form them together, and help us to establish a diagnosis. Now there are some AI tools that we can use, that we can enter some of these things, and it might give us a list of conditions that might meet these criteria that these disparate bits of information point towards. So that's one way I can see. Another thing I can see with the explosion of information is that patients, in many ways, they're empowered, and sometimes you have to convince them that yes, you have Googled it, but that doesn't mean you have this diagnosis. Or, sometimes I find myself having to justify my treatment plan for a diagnosis I've made in a patient. The patient says, well, they're on their phone when I'm telling them what I think it is, and says, well, it says this medicine can give me this side effect. Can you give me any medicine that doesn't have any side effects? How about this medicine? So they're much more sophisticated, but unfortunately, often, as you can imagine, patients might not use all the information in the most appropriate manner, because you can't, right now, you're not at a point where you can use AI to diagnose yourself and come up with your best treatment plan. But some people kind of think that they can. But I don't mind that, because I feel like we're a bit more on the peer level, and I am able to engage them with respect to the knowledge that they're bringing to the table. I'm actually happy that many more patients now are so interested that they'll do their own background research on their symptoms or their conditions.
Well, I have to admit, Dr. Richardson, I would probably be your nightmare patient, because I probably would ask a lot of questions and read, because I am an inquisitive like fella.
Well, I wouldn't find that a nightmare, because what I'm looking for here is engagement. And I think the more engagement I have with a patient, the more likely they are to be compliant with medication. And the more empowered you give a patient, the more knowledge you give a patient, typically you can be partners with them in getting over this disease or treating this disease. Whereas if it's just this mystery that they don't understand, then often they're less connected to their own treatment.
Wow. Thank you for that. Neurology often involves life-altering discussions. How do you approach conversations with patients and families during the critical moments?
Yeah, that's a good question. So I've been doing it a while, so I'm pretty intuitive. I mean, there are some people let's say I have an individual and family member that the patient has Alzheimer's disease. And some people are particularly defensive if you're talking about them to other family members in their presence, or talking about something they're not doing well, like remembering things. So I've found a way to negotiate that exchange, and it sometimes is challenging. You've got to keep a person's dignity intact while you're discussing a disorder that is really it adversely affects their decision making. They have poor memory, often poor judgment. They may have hygiene issues, and the question is, how can you discuss this issue with them sitting right there?
Wow.
But there are actually ways to do it. There's angles you can take that will allow the person to be engaged in this discussion and not be talked about and not be talked down to. But there's a little bit of art to that. And I have to say that I've developed a means of doing that. And there are different ways to do it, and I typically find a way to get through these difficult moments and allow a person to keep their dignity.
You strike me as a very caring professional. I can tell. Very,
I
very
try to be.
so.
I certainly try to be. I mean, I'm in this to help people, and so that's one of the things that is out there for me. And I'm going to circle back to some of my early decision making about becoming a doctor. I mean, I was at the time an individual who came from a family where there had never been any professionals. I guess the most professional individual, I should take that back. My mother was a secretary when at the time she was working. My father was a blue collar worker when he was working. My grandparents had been basically blue collar workers. Most of my uncles were blue collar workers. And one of the things is, how could I envision for myself becoming a doctor? I'd never seen a black doctor in my life, and I certainly didn't know any. And I have to say, when I was at this school, Golden Gate Academy, it was a church school, a Christian school, and I remember reading a text in the Bible that said something to the effect of, "Taste me to see that I am good," which, when you study in the context of that was, the Lord, I felt that the Lord was saying to me, "Hey, I am here. I will prove it to you. Give me a chance."
Right.
And so I said, okay. I basically said, all right, Lord, if you are here, if you are really here, A, I want you to help me to get good grades in school. B, I want you to help me to want to get good grades in school. And C, ultimately, I want you to help me to be a doctor. If you're really here, help me do this. And, it happened.
You know what? I'm just going to kind of go off my kind of digress just for 2 or 3 minutes. As a medical professional, do you ever find that you you allow your patients to talk about their faith and their belief?
Yes, I certainly do.
Okay.
And that's something that if a patient is leaning in that direction, that can be a big part of our exchange. I won't necessarily go there if an individual isn't showing me a tendency to really want to go there. I don't want to force my belief in God on anybody else. And I see people of all religions and no religion and try to make that connection. But yes, I'm very open and interested in the spiritual realm, and interested in the relationship that people have with higher power. And I let them know that, hey, I yield to a higher power as I'm trying to help you with this condition. And I will depend on this higher power to help us get through it together.
Wow. That's a beautiful, as a man of faith, that warms my heart. In your opinion, what are the most exciting or some of the most exciting breakthroughs on the horizon about the field of neurology?
Okay. Well, we've had some huge breakthroughs in the last 20 years. First and foremost, I'd have to say developments in treating strokes. About 15 years ago, stroke was the number 3 leading cause of death in this country, behind heart disease and cancer. But lo and behold, some huge developments were there that allowed us to, if we were able to get a patient to the hospital in time, to give them medicines that could help to reverse the effects of stroke, and B, identify the risk factors of stroke, intervene, and people with these risk factors like high blood pressure, high cholesterol, diabetes, and such, get them on treatment plans and reduce their chances of stroke. And lo and behold, today, 20 years later, stroke has gone from the number 3 leading cause of death to about number 5.
Oh, that's wonderful.
Yeah. So that's been an exciting development that I've been on the ground floor of. Another very important development is probably the number 1 neurological disorder that's out there now is Alzheimer's disease, which is very closely related to age. And prior to the 90s, there were no treatments available for patients with Alzheimer's disease. But now we have medications that can be helpful in improving memory in patients with Alzheimer's disease. And we've identified and developed a few medications that we can give when a person has pre-Alzheimer's disease. They haven't quite developed full-blown dementia, full-blown Alzheimer's disease, but we see signs that it's going in that direction. We've developed some treatments that we can give patients that can slow things down, or in some cases help prevent them from transitioning into Alzheimer's disease. And this is really a huge development because there are millions of people in the world with Alzheimer's, and the numbers are going up because it's closely associated with age, and our population is living longer. So this is a huge development that's actually been very exciting.
Alzheimer's, probably my mom had Alzheimer's, and I recall my mother lived to be 96, and she lived a very, very long life. But it would come and go, and I remember she passed about 10 years ago. Some days I would see her, and her eyes would demonstrate 100% alertness. And sometimes I would go to her house and I could look in her eyes, and it would just look as though she was there, but she wasn't there. I don't know if that has any bearing, but I used to always be able to look at my mother, who I love to death, and say, her memory is not working well today.
Yeah, there can be a certain amount of variability in day-to-day function in patients with Alzheimer's. That's one of the things that we do see, yes.
Wow. How do you maintain your own mental and physical resilience in such a high-stakes profession?
Yeah, well, as I alluded to earlier, you got to take some time for yourself. And, I have some hobbies that I engage in, and some life practices that I think help to sustain me. I have to say, number one of my biggest hobbies is music. And I'm a jazz musician. I play the guitar. And that's something that I pursue regularly. And another thing I do is I exercise regularly. I try to exercise at least 4 or 5 times a week. And I either will do some bike riding or hiking, walking, elliptical, weightlifting, rowing. I've got a bunch of little things that I have available to me. And I try to do that just about every day. And that I think keeps me healthy, keeps the blood flowing. And so those are some of the tools that I use to keep me interested, keep me recharged.
Well, as a musician myself, and as a well-known musician, I am really grateful to see, as a professional, as a medical professional, that is one of your interests as well.
Yeah.
God bless you. If you could give one piece of advice to aspiring neurologists, what would it be?
I would say, believe that you can reach your goals and pursue them with all your might. And your journey will be fruitful. That's one of the things that can be challenging for especially people of color. There aren't very many of us in the field of neurology, for example. When I came into practice in the 90s, I was the only Black neurologist in the Bay Area that I was aware of. And here it is in 2025, and I am not aware of any other Black neurologists in the Bay Area still. So this is a field that's, there aren't very many of us. And the numbers of Black physicians has gone down over the last 30 years. And the numbers of Black male physicians have gone down. The Black female numbers have gone up a bit, but overall the numbers have gone down. So, and this is a very important thing because data shows that while certainly patients can get benefit from doctors of any ethnicity, the doctors that are able to be most successful in treating Black patients are Black doctors. It seems that the connection that we're able to make with our patients makes a huge difference in patient compliance and patient outcomes. So if you have the desire to pursue this goal, have confidence in yourself, pursue it with all your might, it can be done. Now, of course, you've got to be very smart in how you pursue it because it's in some ways a competition. Not anybody can get in medical school. Well, potentially anybody can, but you've got to have the right credentials. Your grade point average has to be where it needs in a certain range. Your scores, your entry scores have to be within a certain range. So those are things. So with a little bit of foresight, a little bit of guidance, good decision making, you can have the tools and the credentials, the background that'll be necessary to get you there. But it takes some foreplanning, some foresight, and some help.
It was Dr. Richardson. It was so nice reading about your background, and I'm sure you're right, because I didn't even know there was an African American neurologist in the area until I met your wonderful wife, Dr. Denise. And then when she said, my husband is a neurologist. And so when I went on and I said, oh, wow. And so I was so enthralled. I want to go back and ask one question before we come to just asking your final thoughts. With the rise of robotics and AI, especially AI, do you ever feel that these tools will affect the work of neurosurgeons and neurologists? Meaning that, I've only been operated on once when I got really, really sick, and I was sick for I had a septic disease a couple of years ago. But sometimes I wonder, with AI taking over people's jobs and what have you, sometimes I wonder if they will affect educators and medical professionals. Will there be a robot in the medical room operating on somebody, or being a robot who would give a diagnosis? Do those conversations ever come up in your profession?
So far, they're not really coming up directly. There is there is robotic surgery now, where people are using robotics to assist with surgery, but we're nowhere near a horizon where we can foresee a robot independently doing an operation on a person. But that may be something that comes to fruition one day. With respect to AI and diagnosis, that's something that we speak about, and people are using it as sort of small tools. It's certainly possible that it may become more and more important over time. And now, for the foreseeable future, AI and robots will not replace humans, but many years down the line, who knows what we can see.
Dr. Richardson, it has been such a joy and a delight for me to speak with you, and to personally on Zoom meet you. I had a chance to meet Dr. Denise, your lovely wife, at the National Council of Black American Affairs, and I hadn't seen Dr. Denise for a long time. And working as an adjunct, I just took this because my main district where I was tenured was Contra Costa Community College District, and then just getting a music class that I was teaching in College of Alameda, we passed cross and kind of came back. But I can see why the two of you make a beautiful couple.
Thank you.
Both of you are very highly intelligent professionals, and I'm sure the two of you make a beautiful union. Having said that, are there any final thoughts and ideas that you would like to communicate to our media world?
Well, first of all, let me say I'm pleased and very happy that you asked me to be on your program. I'm hopeful that my words can be of help to some person who's hoping to pursue their goals. But one of the things I'm impressed with, and I've been more and more impressed with this over recent times, is looking at this concept of ethnicity and how people of color have somehow been perceived in modern times as being primitive, less intelligent, less accomplished, and less able to attain greatness and make major contributions to science, to the other areas of education and academics. But, I think this is really unusual when you look at the history of mankind. For tens of thousands of years, it was actually Black people, people of color, that were the first places where civilization existed. And civilization as we know it today, while some will think it came from the Greeks, if you look at Greek history, the Greeks got their knowledge of astronomy, of mathematics, from the Africans, from the Egyptians. Now, many of us think, oh, Egyptians, that's North Africa, that's not Africa. Well, that's a modern concept. And in reality, the ancient Egyptians were not some separate entity from those other Africans in the continent. And the ancient Greeks, if you look at history, they got their whole concept of mathematics, philosophy, and the foundations of modern knowledge from Africa. If you look further down many, many centuries, it was those from Africa, Africans and those from what is now known as the Middle East, who brought Europe out of the quote unquote dark ages and again taught them science, medicine, architecture, knowledge of personal hygiene, of transportation, of sanitation. So this whole idea that we as Black people are primitive or are from a primitive people, that is a fallacy. So if any of us need any sort of affirmations or any sort of belief that we can reach our goals and make contributions to society, we need look no further than history.
Wow. That reminds me of, I believe in the early formation of education, there was a word called the quadrivium that where many of the major universities, or the major universities, would always concentrate on the study of science and astronomy and mathematics. And so it is wonderful to see that you have developed yourself into such not only an informed professional, but a great medical professional. As the president of this podcast and this company, I want to thank you for taking the time out of your busy schedule. I hope I didn't take too much of your time today. Please enjoy your Friday, rest, and please once again give a wonderful hug to your lovely wife and your wonderful children.
Will do. Thanks for having me.
God bless you.
You too.
Bye-bye now.